Hello, I'm Donald Macaulay from BJGP. Today I'm talking with Dr. Steve Bradley, who's an academic clinical fellow in Leeds and a GP in inner city Leeds. Steve, this COVID-19 has really changed the way we practice. Tell me a little bit about your practice.
Well, things have changed utterly. So our practice is a specialist service for um, patients who could suffer exclusion, so homeless people, asylum seekers, immigrants, and refugees. And we've had to really change how we do everything. So total triage is a challenge for every practice, but it's a real challenge for our practice and for reaching our patients, many of whom would access us by turning up at the front door and saying they need help.
So are these patients living on the street?
Yeah, so we've got a mixture of patients. So some are what we call street homeless, so they're literally live on the street. And then there's a huge kind of overlap between people who are what we call sofa surfing. So they're vulnerably housed, they're moving from place to place, which obviously is a disaster for this kind of illness. And people who may have recently been homeless or may be at risk of being homeless again in the future. And then we've also got people who are refugees and immigrants as well.
What particular concerns do your patients have, indeed the homeless and those living in hostels?
Well, a lot of our patients have mental health problems anyway. A lot of our patients struggle with anxiety, and this sort of situation, I think, is really very, very difficult for them to deal with and to cope with, particularly with when our patients don't have the resources that a lot of other people would take for granted. They can't simply isolate themselves. A lot of the government advice is just not really realistic for them. A lot of them have chronic health diseases anyway, so feel themselves to be particularly vulnerable. So it's really very, very challenging for a lot of our patients. As a practice, we're trying to identify patients who are particularly vulnerable and to work out whether they have the support that they need if they need to isolate as well. I think really everybody just needs to be thinking about the patients that they're aware of and the people that they're aware of and ask whether they have the support that they need to isolate if they need to.
Do you provide methadone maintenance in your practice, and how does it work?
That's a really big challenge, and a lot of my colleagues in our service are involved in the drugs treatment program and opiate substitution therapy, and that's been a real challenge in terms of getting these patients the opiate substitution that they need, which usually is given on a daily basis, and we're telling people not to come out unless it's necessary. But so we're having to make adaptations as to how often they pick up their medications. So it's really been very challenging. I know from having spoken to my colleagues that they're having to make a lot of decisions about the duration of pickups for the methadone, and really just being pragmatic and taking a very thorough risk balance approach at all times, because there's a lot of provisions that we would have made when none of this was around about patient safety that just are not practical or safe indeed at the minute. So a lot of nimble thinking and being pragmatic and practical and trying to do the right thing for the patient.
Thank you very much for sharing your thoughts on this very vulnerable population. I'm Donald Macaulay from BJGP, and today I've been talking to Dr. Steve Bradley from Leeds, who provides a service for vulnerable people in the community. Thank you very much indeed, Steve.
Thanks a lot, Donald.